Hello everybody, and here Elena with Let's Talk. And today I'm so excited to introduce you a very interesting person who you in the near future would love to look for. And it will be, for some people, most wanted person in your life, because this person, like a Christmas or Santa Claus or any most wanted gift in your life, will be delivered through this person. This man does miracles, and he did a miracle for me personally. I got a beautiful baby, and I will not go to details why I needed that procedure, and you will know later on. But I'm so happy with delivery and with service and with attention. Attention, it is most important for women, especially those who are in this vulnerable situation. Let me introduce you a wonderful person, father of 3, unbelievable professional, great person with a very quality characteristic, I would say, very good friend, who is medical director and HRC fertility Encino, Dr. Michael Feinman. Hello, Michael.
Hi, how are you? Good to see you.
It is my pleasure to interview you today because you did a lot for other people, including me. So because of you, I have my happiness, beautiful daughter. And I know you for many, many years and would love to ask you a lot of questions.
I'm here.
And those questions actually been asked by other women and men as well. So during your years as a professor in New York, you pioneered some procedures. Could you tell about a little bit?
Yes, those were very exciting times. We were able to do 2 unique things in those years. The first was we actually started really the world's first anonymous egg donor program. We had opportunity to approach women having their tubes tied laparoscopically, and some of these women volunteered to donate eggs at the time of the procedure. We paid them all of $500, which is crazy compared to the prices that women get for egg donation now. Also, we actually did what we believe was the first ultrasound-guided egg retrieval in New York. I can't say the world, or not the world for sure, not the country, but for sure the first vaginal ultrasound egg retrieval in New York, because we purchased the first vaginal probe ever sold in New York. Until that time, egg retrievals were actually done surgically with laparoscopy. So this was a big breakthrough, which also led to the ability to do anonymous egg donation more freely like we do now.
Wonderful. There is many IVF doctors in LA, and you're one of them. What makes you different?
Well, first of all, I certainly have a lot of experience at this point. But I think that compared to many of the doctors in LA, I try to be very accessible and answer questions as fully and honestly as possible. Patients have access to my email and get to me very easily. And I do try to give a thorough picture of their situation, not just delve into a treatment, rushing them along. Also, I pay a lot of attention to previous IVF failures and focus on women who might be considered poor prognosis, but can help them sometimes.
When should a couple see a specialist like you?
Well, infertility is defined as 1 year of unprotected intercourse without a pregnancy. And that's a pretty old-fashioned definition based on younger women. It still makes sense because most women will get pregnant in a year. But certainly as women are approaching their later reproductive years after 35, they might want to see a specialist at 6 months just to make sure everything's okay. It's not necessarily that they will need treatment, but it's good to know if there's a problem earlier than later for those women.
So you are targeting women what age?
We don't target anybody. We're happy to have women 22 to 42, but the point is that women who are a little over 35 might want to see a doctor sooner than later, make sure there's no problems. If everything is okay, it may be appropriate to keep trying, but at least that it's not impossible.
Is it any guarantees you can give?
Guarantee is a dirty word in our practice. There are some programs that offer guarantee packages. We've refrained from that because the cost of success is also high. Instead, we offer packages that put a lot of services into one price and let the women have as many embryo transfers as possible with whatever embryos they develop until they're pregnant.
During the procedures, everything can happen. And for example, failed IVF cycles can be very frustrating. So how do you advise such patients, and other tests you recommend for these patients?
Yes, we've put together a very comprehensive program of evaluating both failed IVF cycles and recurrent pregnancy loss, miscarriage. So it's a thorough evaluation, includes x-rays, sometimes chromosome studies, and then in appropriate cases we do immunological testing to see if the immune system is playing a role in rejecting the embryos. We work closely with a place called the Rosalind Institute in Chicago, which is well known for this evaluation. And in many cases, we help people who have had multiple failures or recurrent pregnancy losses.
So immunity plays over here a most important role, right?
We believe it does. It's controversial, but it makes sense. A husband's embryo is a foreign body to a woman, just like his kidney would be. Furthermore, there's a possibility that women have autoimmune conditions, antibodies or immune conditions that reject the embryo. Again, controversial, but there's a lot of evidence to suggest this is true, and with the very focused evaluation we do, it's not terribly expensive, it doesn't take tons of blood tests, and we can sometimes focus in on what might be a potential problem causing the recurrent pregnancy losses or IVF failures.
As you know, some men in a certain age do vasectomy. Do you work with patients like that?
Oh yes, we love those patients because we get very good success rates. So obviously men with previous vasectomies have two choices. They can reverse the surgery, or they can go through, the wife can go through IVF, where we extract the sperm right from the scrotum, okay, in a little incision, a tiny operation. The general rule, if the vasectomy is more than 7 years old, what we do is probably better than a reversal. The longer the time from the surgery, the worse the outcome for a reversal. And certainly if a woman is also starting to be at advanced age, the IVF process gives quicker results. And of course, there is a certain percentage of men will have a failed reversal, so they have to come back and do the IVF anyway. So that's not so great for women over 37, let's say, who doesn't have a lot of time to waste. Another advantage of what we do over reversal is the couple still has their birth control in place, right? So we get a little sperm out of the gentleman, he has a lifetime worth of sperm there, and then we create embryos for the wife. And once they're pregnant, hopefully, they still have their birth control in place. It's kind of convenient.
I've heard about treatment called InVoCell. InVoCell. What is that, and do you offer that?
Yes. We're one of the few programs in Southern California that has InVoCell. InVoCell is an interesting variation of IVF. There's a small device about that big. It's actually an incubator, and the women carry it inside. So the theme of InVoCell is less cost, less drugs, less eggs, less risk. So for idealized patients who have a good male factor and don't want to do chromosome testing on the embryo, so these would generally be women under 37, this offers something better than IUI and a little less expensive than IVF. Our experience with the InVoCell device is a very good incubator, actually. The embryos we get out of it are beautiful, and we've had pretty much the same success rates with InVoCell as we do with IVF. So the idea that it's lower success, I think, isn't true. And it's an interesting option for some couples who are either put off by the high-tech approach of IVF or the cost.
So basically, it will be not only quality of a procedure, it will be financial, much gain. And some women want to put more embryos. Is it a good idea? For example, they wanted to have twins or maybe more. Is it a good idea?
With putting aside the InVoCell patients for a moment, because they tend to get smaller number of embryos because we use less drugs, Most of our patients, not all, but most of our patients do the so-called PGT testing, pre-implantation genetic testing, so you rule out Down syndrome and similar problems. So the number one reason in the old days that IVF failed, we believe, was because of abnormal embryos. So the replacing of multiple embryos balanced for that, thinking that hopefully, one would be normal, but of course, we got multiple pregnancies doing that. So it's been shown that either with PGT testing or for women under 35, putting in more embryos does not improve the pregnancy rate. It only increases the twin rate. Now, twins might sound cute and a good bargain for the money, but twins have a higher rate of prematurity, a higher rate of the brain damage called cerebral palsy, and even on a good outcome, many of these babies spend weeks in the hospital at $10,000 a day if they're in the intensive care unit. And even if they come out seeming okay, there's even an increased rate of lifelong learning disabilities and subtle, small things that are more noticeable in twins. So as a rule, these days, we're seldom putting in more than one embryo.
I heard a very strange thing. For example, if they put in more than 2 or 3 embryos and they all good one, they say we eliminate them. Is it true?
Well, it can be done, but it should. Just because something can be done doesn't mean it should be done. Yeah. So that procedure is called selective reduction, and it was more popular in the old days when we didn't have the chromosome testing, and we would put in more than one embryo and occasionally get triplets or more. So to purposely put in more embryos with the plan of doing that is a bad plan. I mean, it's very traumatic and expensive to go through selective reduction. Of course, some women will lose the whole pregnancy afterwards. So no one does that anymore. Most of the triplets that come are accidents, like a splitting embryo or something like that. So I think the selective reduction doctors are going to be out of business soon, hopefully. And they'll be happy to. They don't want to do it either.
The situation on fertility market right now is leaning toward younger generation. I know that some women, even 20, 30 years old, needs your service. Could you explain this phenomena? What's going on in the world? Why it's happening?
Well, I'm not sure that I'm not sure what you're asking, actually.
It is your just opinion, general opinion. It's nothing to do with your practice, but around the world right now, I noticed, and a lot of people too, that younger women needs service.
But they always did. The fertility is not an age-related thing only, right?
Oh, really?
No, that's just part of it. Women could have blocked tubes at a young age. A man could have low sperm count at a young age. A woman could not ovulate, but many of my young patients, my not ovulating patients, are young women. So I'm not sure there's a trend towards more infertility in the world. I don't know if that's true. What we do see is because of delayed childbearing, certainly we're seeing many, many patients coming in because they've waited too long. That's true. But I mean, when I was in training and a young doctor, my patients were young. They had all the things I said to you: low sperm counts, blocked tubes, not ovulating, endometriosis. These are things that affect young women.
Age is not important.
It's important, but it's not the driver of infertility. It's a cause of infertility as women age. That's true. But young women have all the problems that I just mentioned to you. Young couples have all the problems I just mentioned to you.
Okay, and what kind of advice you would give then for women who would love to be a mother in the future? Maybe some lifestyle change or something. What kind of advice from you as a doctor?
Well, the only lifestyle factor that's been well proven to affect fertility is weight. So as you know, we have a big problem in the United States with obesity. It's a delicate topic, you have to tread carefully. But as a doctor, I can say a little more honestly that if you ask that question, the one thing a couple, not just the woman, but the man too, can do to improve their fertility when they want to have children is to not have a high body mass index. So if they really do have a weight problem, working with nutritionists to not have crazy fad diets, but to really change their diet for a lifetime lifestyle change is the best way. Now, obviously, some women in their 30s are already obese or overweight. and they don't want to have children right away, so it's going to take them years to lose that weight, right?
Yeah.
So what we do have available with good success rates now is the ability to freeze eggs to store their fertility for the future. So occasionally when I do see women in their mid to late 30s who need to lose weight, we talk about freezing some of their eggs before they go into a 1 or 2 year weight loss program, then come back and try to get pregnant naturally, or use those frozen eggs that they stored at a younger time.
Wonderful. I like your varieties. You improved a lot. Right now, vaccination is a most topic question. Is it a fact, the procedure, what you do?
Well,
and explain about myths about mRNA vaccine.
Okay, well, first of all, let me dispel the myth about mRNA. Okay, mRNA are little molecules that go into the cells, but not the nucleus, and from there, the cell uses that mRNA to produce proteins. So in the old days, we injected the protein of the virus, like smallpox, measles, all that. You got the protein from the virus. So here we're giving mRNA to get absorbed by the cells. It doesn't last very long. The mRNA is gone like that. So it's maybe a day, maybe 2 days, it's in the cell. And so the cell uses that mRNA to copy and make its own proteins that then tip off the immune system to produce antibodies to the virus. So although it would take years to really look at the effect of any treatment, including a vaccine, on fertility, the idea that it somehow gets into your DNA and changes you is totally ridiculous. It's not true. It's impossible. That's not what mRNA does. Now,
I'm so happy to hear that.
Thank you. It's ridiculous. I don't mean to be, I know in certain communities there's this belief that it can change you. It's totally ridiculous. It's a myth. It's like saying it's...
Wow.
If you can believe in Santa Claus more than this, okay? So, however, any treatment has to be evaluated. So, all I can say is that no vaccine has been known to cause infertility. No vaccine has been known to damage babies or hurt the pregnancy. So, based on that, it's reasonable to assume that this vaccine is safe. However, as a practical person, I would say, if you're planning an IVF cycle or other treatment, and you're going to get vaccinated, certainly wait a month or two, to let that potential effect fade away. Because we don't have a lot of information on the vaccine in pregnancy, I would probably delay the vaccine till the second trimester. However, it's a balance, because ACOG, the American College of Obstetrics and Gynecology, has said that pregnancy is a risk factor for complications with COVID, like advanced age and other medical conditions. So, it's hard to find that balance, and I think avoiding it before treatment is appropriate, and possibly delaying it till the second trimester is appropriate. But
basically, it's a lot
I would
of luck.
not advise women looking to get pregnant to skip the vaccine. This Christmas weekend, I was called by a patient who continued to refuse to get the vaccine. I kept begging her to do it before her embryo transfer. She got pregnant with her first IVF transfer, and of course on Christmas weekend she's calling me every day. She's positive, she's got COVID, and she's freaking out because she never got vaccinated. So, once you've got it, you can't reverse it. Fortunately, she had a mild case, she's fine. And of course it is true for 98% of people. But you don't want to be one of those 1 or 2% that are sick and pregnant.
Okay, it's a lot of luck involved, I can see. Here is probably another myth, what you can spill out. For example, people think that generations that were born with IVF way, they will not have own kids. I never heard like this ridiculous
Yes, that's
thing.
a ridiculous thing. If it's of any comfort to people, I actually have a couple of things. I have daughters of surrogates who are now surrogates. Okay, so that means that not only, so they had to have their own children before they could be surrogates, and so that's good news. And we try to treat surrogates and egg donors like people, not just treat them like, pat them on this, thank you very, but I try to take each person individually and show care and, concern for everybody. So we have egg donors through the years who've called us saying, oh, by the way, I got married and I have my own children now. I just thought you'd like to know that. So there really is no reason that just getting conceived through IVF would cause the children to have fertility problems.
Very good news. I love it. And here is the most ridiculous question. I don't know where people coming from. So you're basically doing God's job, and some people are concerned. Is it soul goes together with the body what you create, actually?
We're not doing God's work like other doctors. We're facilitating God's work. Okay, you could say that curing cancer is God's work, or correcting your eyesight is unnatural, right? So we're helping it along. But if you're going to talk about God, without God's help, you're not going to get the pregnancy. Okay, so except for our Catholic friends, most Christians and Jews and Muslims believe that, life begins sometime after conception. So, obviously I can't scientifically prove it, but, no baby occurs, if you're religious, no baby occurs without God's help, and they certainly have a soul.
And soul. This is most concerned for people. I don't know how you can measure do you have a soul or not. I'm looking at differently on people. If you're a good person, you probably have a soul.
Well, people who believe in God and souls also thus have to believe that you can't live without a soul. So
that's right.
The soul is the driving force, the life force that keeps you alive. So if you don't believe in souls, this conversation is ridiculous. If you believe in souls, then you can't be alive without a soul. And many rabbis and devout Christians come to us. So if they didn't think there was a soul involved, they wouldn't be here.
Interesting point. This is very important procedure, and why is not covered by medical insurances?
Well, how do I know the answer? Because they're cheap bastards. Why? It's a good question. Why? I mean, I can't answer that.
Do you think it's possible in the future they will cover that?
Well, about 1/3 of our patients have health insurance coverage. The truth is that almost every insurance company has a policy that includes IVF. It's up to the employer to provide it. So the answer is they're being cheap and selfish, basically. It's not necessarily the interest of the insurance companies to not cover it because, especially in the older days, not so much now, because of this problem, the doctors tended to put more embryos back, try to get the pregnancy quickly, even get the twins to, have it 2 for the price of 1. Mm-hmm. But what happened was, of course, these pregnancies were very expensive for the insurance companies, right? Twins and triplets are going to be expensive pregnancies for insurance companies. So it was not in their interest to not cover. They ended up spending hundreds of thousands of dollars on pregnancies instead of tens of thousands of dollars on the IVF cycles. But it's clearly about money. They hide behind this stupid excuse that IVF is experimental treatment. It's been there for like 50 years now, 40 years, but it's still experimental. So, it's clearly money.
I will show this video to insurances.
Yes, please do.
I will. What about cost of this procedure?
Well, clearly cost is a major issue to people. That's one of the reasons InVoCell became a popular alternative. As I said, about 1/3 of our patients have insurance coverage. For the other third, obviously, it's out of pocket. For those people, we've designed these packages that we think are good values. We're not the cheapest program in LA, but we're not the most expensive either. We also have financing available. That's exciting. So there are 2 groups we work with. One is called CapEx MD. We're the exclusive Southern California provider for them. They provide unsecured loans for people wanting to do fertility treatment. They're relatively high interest, but unsecured and easy to get. Most patients pay them off quickly. So if you get pregnant, it's like a car payment, right? You pay it off and you get done quickly. We also work with a lovely, wonderful group called the Jewish Free Loan Association, which has a branch specifically committed to infertility patients who need financial help, with no concern about their religion or affiliation. It's open to all patients, and that's an interest-free loan. It's a little harder to get, a little more paperwork and hassle, but we have patients who get it, and we at HRC, all of us contribute financially to this organization to provide them money to be able to lend out to patients.
Wonderful. Do you work with foreign people, and
Yes.
what's the procedures they have to go through before they will see you?
Well, most patients that come here from overseas are seeking things that are not allowed in their countries. So obviously most of the countries, including Russia and Ukraine, have respectable IVF programs. China, Australia, they all have it. But they come here seeking things that are not allowed. The typical things not allowed in most of the world are egg donation, surrogacy, and gender selection. So we do have people coming from all over the world seeking these services. So these, of course, right now during the pandemic, it's been hard. We're starting to see a little bit of activity coming back from all these different places. China, unfortunately, doesn't allow shipment of any biological material, so those folks have been pretty much stuck at home. But Australia, Russia, Europe does allow shipment, so some people have been able to ship sperm over and get going that way. So it depends what the need is, what the appropriate nature of it is. We do Skype and Zoom consultations, and then we plan the treatment for when they can either ship their materials over here or get over here personally. And of course, right now with this stupid Omicron surge, it's a little tough, but that will go away too, and hopefully by the spring and summer, travel will be more practical again.
I know how important good people around the patients, and I know that you have always the best people and nurses, and they're helpful very much, and highly recommend you from personal experience. And what you will tell for humanity in these days, or for future parents, from your bottom of your heart, because you are such a good person, and I know you will give some good advices and maybe hopes for other people.
Well, first of all, Elena, thank you. I guess I've had a modestly successful career, very satisfying time. I've hopefully helped many lovely people like you. But still, for me, the most satisfying part of my life is my family. Being with my wife and children is still the most fulfilling part of my life. So I would say to anybody who's chasing that career and their education, it's all important and worthwhile. But don't lose sight of the fact that having a family is still the most fulfilling part of life. So for those couples who are delaying childbearing because of career and education, if you can, try to have that baby. I know it's hard. I was in training, a fellow when I had my first child, and it was obviously hard. But we did it, and thank goodness. And he's a big boy now, and the joy of our life. And as you said, I had 2 other sons after him. I'm not saying this callously. I know it's hard, but I would say try to have that baby as soon as you can, when you can. Certainly for women delaying childbearing, egg freezing is a good option to have increased chance for children later in life, but you shouldn't see it as a guarantee. So I would say freeze your eggs and try to get pregnant as soon as you can if you're in your 30s. The pandemic's been a drag, but we've been open almost the whole time except for those first 2 months, and we're very careful and cautious with our protocols. We have no proven transmission of the virus in our offices, so it's been a safe environment, and we're here for you, whether you're in the good old US of A or overseas.
And last question, by the way, do you have any similar businesses that contribute to your practice that healthy men and women can participate in? For example, donors.
Well, we do not have our own in-house donor agencies. We work with donor agencies outside and surrogate agencies to provide those services.
Wonderful. You don't want to tell even more
What is that, my wife?
Because some people would love to be donors, some sperm donors, or women would love to be donors.
If people would like to volunteer to, I mean, it's obviously not a volunteer job. If they want to volunteer to be sperm donors, egg donors, or surrogates, we don't take them in generally, but we would refer them to agencies that we like, and then hopefully we get to work with you afterwards. Certainly for sperm, the easiest thing is to call the California Cryobank in Santa Monica. They're the biggest and they're terrific, and we work with them a lot. We're definitely not in the sperm bank business. But with surrogates and egg donors, oftentimes if we have made the referral, we get to work with them later, and that's a nice thing.
So wonderful. We covered the most important information.
Thank you, Elena. It's great to see you again. I wish you and all of your viewers a happy, healthy New Year. Hope if you need our services, we get to see you. I love Russian people. I'm, Russian descent, and so I don't wish it on anybody. But if you need me, I'm here.
How we can find you and how we will contact you.
Okay. If someone would like to set up either an in-person or Skype or Zoom consult, they can call the office at 818-788-7288. Or they can get a lot of information about everything I've said today, including how to make an appointment at our website, havingbabies.com. For those people who think they would like a little extra help, working with Elena is terrific. She could provide translation for people coming from out of town, help you with reservations, and help you find places to stay and so forth.
Thank you. Wonderful. And wish you luck and success.
Thank you.
Bye. Thank you for being with us. I'll see you next time.